Hello and welcome to week 2 of HIM250. This is your capstone and getting you ready to sit for the certified inpatient coding certification. So you can put that on your resume and it'll help you get a job faster and for higher pay. How fun is that? Yes. Okay. So remember that this course is going to be about reviewing everything, basically diagnosis coding and ICD-10 PCS coding, as well as all of the reimbursement and mechanics, if you will, that are involved in medical coding and billing, okay, in the process. So you might wonder, why are we having a whole week of anatomy, physiology, and medical terminology review? And that is because, if you haven't figured it out by now, you need to speak the language so you can accurately interpret. So the first thing I want to remind you is, if you don't have a medical dictionary, get a medical dictionary. Amazon has the Merriam-Webster Medical Dictionary paperback for less than $10. Okay. And it is now I know it sounds old-fashioned to say paper dictionary, but I find that to have it literally right at your hand is going to encourage you to, when you encounter a word that you don't understand, to look it up. Okay. And that is very important as you build your knowledge of anatomy, physiology, and medical terminology, because once you look up the same word 4 or 5 times, it'll stick in your brain. That's how you do it. You cannot memorize an entire dictionary. That's why they have dictionaries, okay? Now, the Merriam-Webster Medical Dictionary is also available online, and you can bookmark that or favorite it, whatever your system calls it. But what I want you to remember is, during some assessments, you will not be permitted to click off screen to look something else up. So what I'm telling you is, you can use your paper medical dictionary during these assessments, during the learning. I do not believe that AAPC permits you to bring a medical dictionary with you to the exam. But by the time you get to that point, you'll know the stuff. You'll be familiar with the language, and it won't be so challenging for you to understand. Okay? Does that make sense? Good. All right. If at any point it doesn't make sense, email me and I'll explain it to you. Okay? That's why I'm here. All right. So this is why coders need to know medical terminology, anatomy, pathophysiology, so you can understand what the physician is documenting, because you need to interpret it into this other language. You need to interpret it into ICD-10 ICD-10 CM for your diagnosis codes, ICD-10 PCS for your procedure codes. If you don't understand what body part they're working on, or what has the infection or the fracture, you can't possibly come up with the correct code. And so I chose a question from the past week's assessment, because it is not so clear. Okay, so week 1 question. And yes, I know we're in week 2, because if we were in week 1, I wouldn't be discussing the answers with you. See? Okay, and this is exactly why you need to complete that analysis assignment. Okay, because that is going to help you work through this to understand where you went wrong if you got a question wrong. All right, so Arlene suffered a CVA, a cerebrovascular accident with sequela of aphasia. Look at that. All those medical terms, only in one sentence. Okay. So first, I want you to remember from medical terminology class, cerebro has to do with the cerebellum, the brain, right? Vascular has to do with a blood vessel, either an artery or a vein. I don't know why I pointed to my arm. We're still in the brain. Okay. Blood vessel, either a vein or an artery in the brain. Okay. Something happened. There was an accident. This is not an accident like a car accident or something like that. When they use the term accident, it kind of means at this point in time, we have not determined specifically what happened, maybe. Okay. With sequela, which means another condition has developed as a result of the CVA. So now the CVA may be over, but we now have a lasting effect of the CVA. A sequela is different from a manifestation. Okay, so let me give you an example. A manifestation is when one condition causes another condition to develop. So they wouldn't have the second condition unless they had the first condition. Like with diabetes mellitus, you can have a manifestation of retinopathy, problems with the eyes, that is directly caused by diabetes mellitus. So why is it a manifestation and not sequela? Because the diabetes has created and continues to create this issue. Sequela can happen at the same time or even after the initial condition has happened and resolved. But there is this lasting effect. This used to be called late effects, if some of you know that term, okay? And aphasia. Aphasia is a great, well, it's one of my favorite terms. Obviously, I don't have it. Okay, it's one of my favorite terms that I use when I teach you medical terminology, because it's a great example of homonyms in medical terminology, okay? Aphasia is pronounced the same way as Aphagia, okay? You see there's one difference, the S or the G. Now, aphasia with a G, think gut, okay? And gut as another term for stomach, right? Okay, well, aphasia with a G means the patient is having difficulty swallowing. Okay. This patient has aphasia with an S for speaking. Now, this is important for you to recognize and understand, because aphasia is not a problem with speaking, like when you have laryngitis and you have trouble speaking. That's not that. That's not aphasia. Okay. Aphasia is when the brain is having trouble finding the right word, formulating the right word, putting words in the right sequence. So, like, you know, I'm sure some of you have had that where you reach for a word, right? And it's not there. Go, oh, wow, I forgot what I was going to say. All right. So aphasia means that the CVA has passed, it's done, but now the patient is having trouble formulating words. This is a neurological issue with the ability to speak. Okay, does that make sense? I hope so. If not, email me. All right, so once she was ready to be discharged from the hospital, she was transferred to another type of facility for physical and speech therapy, expecting to take about 4 to 6 weeks until she can go home. All right. So this is important for the management side of your CIA, your professional certification, and more importantly, your career, is understanding the other types of facilities to which patients can be transferred. Not everybody patient that gets discharged from a hospital is sent home. Okay. And this is important because the documentation must be there. Everything must be clear. Okay. And then it has to do with coding and stuff like that. Okay. But we're not going to get to that point right now. So 4 to 6 weeks until she can go home. So that is a clue to you to go check what you learned about short-term care facilities and long-term care facilities, because both of those facilities have a general scope of the time expected for treatment in that facility. Okay, I'm not going to tell you the answer. I want you to go look it up, because that way you'll remember. If I just tell you, you go, oh, okay, that makes sense. And then poof, it's gone. Okay, go look it up. But that is your key. That's your hint. That's your clue. Okay, as to what that answer is. What is this other facility? Is it a short-term care facility or a long-term care facility? Rehabilitation. Okay. All right. So now let's look at the definitions, because this week is about anatomy, physiology, and medical terminology. So cerebrovascular accident is defined in a medical dictionary as the sudden death of some brain cells due to lack of oxygen when the blood flow to the brain is impaired by a blockage or rupture of an artery. This should be in the brain. In the brain. Okay. All right. So what has happened? Some of you may know the common term for a CVA is stroke. All right. And we have two different types of strokes. We have the hemorrhagic stroke, which is a rupture of an artery in the brain. A rupture, usually an aneurysm in the brain, in a vessel of the brain, and the aneurysm pops. Remember, an aneurysm is like a bubble in the wall of the blood vessel that pops. It floods the brain with blood. The brain can't function when it's drowning. Okay. Then you have another type of CVA or stroke, which is called an ischemic stroke. In the case of an ischemic stroke, the brain is impaired by a blockage. So very often it is an embolus. It could be the formation of a thrombus. What's the difference between a thrombus and an embolus? A thrombus is a blood clot connected to the wall, inside the wall of a vein. So it blocks blood flow, right? But it's stuck to the wall of the vein. When the thrombus breaks loose, it becomes an embolus, and then it floats through along with the flow of the blood, which is bad, because that blood clot, as it's flowing through, once it gets to the lungs or the heart, it's going to cause lots of problems. And in this case, it caused lots of problems in the brain. Stop blood flow. denying the brain cells the oxygen, because as you remember, it is the arteries that bring oxygen to all of the cells of the body, right? So if the blood cannot flow, no oxygen is being delivered. Uh-oh. All right. So you have an ischemic or a hemorrhagic stroke, also known as a cerebrovascular accident. All right. Now, remember, this is the definition in a dictionary. You have to have an idea of what it is. Okay. But the other thing is that looking at that one sentence, when you're on the job, you need to look in the patient's record to see what details the physician has documented as to the cause of the CVA in this particular patient at this particular time. Okay, this definition is rather generic. Okay, but I want you to pay attention to something as we look at the definition for cerebral infarction. A cerebral infarction, also known as a stroke, is a brain lesion in which a cluster of brain cells die when they don't get enough blood. Do you see the commonality between these two? Sudden death of brain cells die. And that's the same thing, only said in a different way. When they don't get enough blood due to lack of oxygen because blood flow is impaired. That's the same thing too. Okay. So is a cerebrovascular accident always an infarction? Why would they have a different name for it? Okay. What it is it's a different detailed specific explanation of what happened. You'll notice that the definition of the CVA has an or in it. We don't know if the CVA was ischemic or hemorrhagic. But I can promise you there should be something in this patient's record that explains that, or if there was an infarct. Okay. So what is the moral to this story? Okay. First of all, the moral to this story is don't only look at one statement. It could be the discharge notice. It could be the summary statement. You need to read the whole case study and read it carefully, or the whole patient record, the physician's documentation. Sometimes you need to look at lab tests, the results of lab tests, pathology, okay? Or the results of the imaging, the report written by the radiologist. This is very, very, very important because as you can see, as you've already started to realize, medical coding requires specific details. And that's why we use medical terminology when we are coding, because medical terms have more specific details in them than regular English. Okay. This just popped in my head. An example is you can say, oh, my child has a temperature. Now, in common language, that means a fever, but technically, it just means that your child is not dead, because thank goodness. But the fact is you got to have a temperature if you're alive. All right. Even if they just carved you out of an avalanche, you're going to have a temperature. It's going to be really, really low, but you're going to have a temperature. okay? Something measurable. But in medical terminology, we say fever, don't we? Fever automatically means a temperature that is higher than 98.6. Do you see? Specificity, specificity, specificity. All right. The other reason or another example or whatever is take a look at the possible codes for this situation. Okay. We have I-69.320 aphasia following cerebral infarction, or I-69.920 aphasia following unspecified cerebrovascular disease. Now, is a cerebrovascular accident a disease? You got to read the notes and absolutely, positively, always query the physician if the details aren't there. You need to have the physician document the details. Now, some coders get very nervous and they say, well, it's not my business to question the physician, but you're not questioning the physician. You are questioning the documentation. And some physicians get very busy. They leave out details. Some physicians don't understand what details you as a medical coder need because they do not write documentation for us. They write documentation for continuity of care, job number one. Okay. So if you are missing a detail, like, did this patient actually have a cerebral infarction? Does this patient have cerebrovascular disease? We just don't know what it is yet. Okay, I need that documented in the chart. But like I said, you got to look for it first to make sure that it isn't there. Okay, but querying for missing information, ambiguous information, or contradictory information that you're finding in the documentation is actually written in the law. You are required to do this. It is written part of your job. So there you go. Okay. All right. So the term CVA is generic. And as I just said, you need to check the rest of the chart to determine if an infarction was documented, and if necessary, query the physician. Did this patient have a cerebrovascular infarction? Chances are you're more likely to see it in the radiology report. Okay, but that's why we made you learn all of these things about coding radiology and learning the terms and pathology and lab tests. This is why you need to understand the terms and the details, because you need to hunt down the information that you need. And if it's on page 4 instead of page 1, it doesn't matter to you because you're going to read all of the pages. Yeah, sorry. That's part of what we do. Okay. All right. So along these lines, you're going to read chapters 2 and 3 in your CIC review book. This is very important. It's going to help you remember, because, you know, what we have found, generally speaking, honestly, we have found, generally speaking, that a lot of coding students, when they go through anatomy, physiology, and medical terminology classes, which, as you know, and even pharmacology, because as you know, they're all prerequisites for coming into coding. But the truth is that most students do not understand why they have to take anatomy, physiology, medical terminology, pharmacology before they get into coding. They don't. And you know, Ms. Johnson and I have been trying for years to figure out how we can communicate this to students who are entering anatomy, physiology, medical terminology, pharmacology, when their ultimate goal is medical coding. And so what happens is, and maybe you, okay, maybe you don't pay that much attention. Maybe you just pick up what you have to pass the test and pass the class. And you say, thank goodness that's done. And you do what is commonly known as a brain dump, okay? Pass the class, thank you very much, leave me alone, okay? So what is really smart for you guys to do is pull out those textbooks that you had for anatomy, physiology, medical terminology, and pharmacology class. And as you're reading these chapters, make sure you use that. Use those textbooks from those classes to, again, refresh your memory, right? What's the difference between the ileum and the ilium? Wait, those two sound the same. ILEUM, the end of the small intestine as it meets up with the large intestine. ILIUM, that's this hip bone. Okay, they're not even part of the same body systems. All right. You got to learn this. You got to study it, review, because that's how it's going to stick in your head. Okay. And hopefully, as you have now gone through your coding classes, you understand firsthand how important it is for medical coding professionals to understand anatomy, physiology, medical terminology, and pharmacology. Okay. It's so very important and will make your job easier. It will make you better at your job. It will help you pass the certification exam because instead of, you know, being English speaking and taking a test in Portuguese, you will actually be able to understand the language. And that's what we want, because that's what you got to do to be successful. Okay. All right. Don't forget your quiz this week. It's good if you don't use your textbooks. I know at the beginning of this, I told you you could use your medical dictionary. Try not to use your medical dictionary, okay? This is important. This is like the pre-test, okay, to get you warmed up. And then we can identify your gaps, your knowledge gaps, so we can fill them in before you sit for the CIC, okay? All right. Then do your analysis. This is so very important. I don't care if you got one question wrong. You need to go back, analyze it. Why did you get it wrong? What did you need to remember or learn in order to get it right the next time? Okay. And cite your sources, because I don't want you just, oh, well, you know, Renee told me that that was the right answer and why. No, sorry. I can't trust Renee. You can't even trust me. I'm a human being. I want you to trust your sources, good sources, your textbooks. Oh yeah, I wrote one of your textbooks. Well, you know what I'm saying. Okay. All right. Extra little things in the course this week, understanding medical terms, all about drugs. We're talking about the legal kind, and pharmaceutical basics. Okay. Whenever you want, I am here for you. I am in the course every day, 7 days a week, not 24 hours a day, but yes, every day, 7 days a week. And so therefore, I can promise you a response to your email within 24 hours. Okay. Use me. I'm a good resource. Truly. I do know stuff. And you know what else is, I always double check all the stuff I tell you guys before I tell you guys, because I only want to tell you accurate things. That's fair, right? Okay. All right. I'll see you in the course. Email me if you have a question. Smart people email.